This is Healthwise.
Cervical cancer is the third most common cancer in women, accounting for 9% of all female cancers and 9% of all cancer deaths in women. Welcome to the only show on television that cares so much about you and your health. On today's episode, we'll be discussing alongside our medical experts, cervical cancer. I am Adishegun Timitope, and this is Healthwise. Welcome back. I'm delighted to introduce Dr. Kasali Oluwakemi. She's Registrar Obstetrician and Gynecologist from Lagos Island Maternity Hospital. Thank you for coming, Dr. Kasali.
You're welcome. Thank you.
Alongside Dr. Kasali Oluwakemi is Dr. Olufemi Olaleye. He's a medical director from Optimal Cancer Care Foundation. You're welcome, Dr. Olufemi.
Thank you for having me.
We'll go on a short break and we'll stay on Healthwise and we're discussing cervical cancer. We'll be right back. Welcome back. Dr. Kasali Oluwakemi, what exactly is cervical cancer?
Cervical cancer, for the purpose of this discussion, it's usually better to talk about what cancer is first.
Okay.
Then we'll now talk about the cervix, so that we can understand where the cervix is in relation to the other parts of the body.
Okay.
Then we'll now talk about cervical cancer.
Okay.
And how it affects the women folk. Normally, when a cell grows in the body, it grows in a programmed fashion.
Okay.
There is a way the cell grows, and then it now forms the body organs and all that. But in cancer, the growth of the cells occur in an haphazard manner. The cells continue to grow, they continue to divide, they leave their primary location, their primary sites, and they are now located in other parts of the body.
Okay.
You know, these cells, we call them tumors. When they grow in an abnormal fashion, we call them tumors. The tumors can be benign or malignant.
Okay.
The malignant tumors are the ones that are dangerous. They are the ones that are life-threatening. Okay. So they are the ones that we actually call cancers. You know, so when you talk about cancers, what comes to your mind is, you know, a sickness that can actually lead to death. So malignant tumor growth from these abnormal cells are the ones that are cancerous. Okay. And they are the ones that are actually life-threatening. Then the cervix itself is the neck of the womb. It's like if you look at the vagina, from the vagina, you see the cervix, from the cervix to the womb. It's a part of the female organ that the doctor usually examines when the woman is in labor. Okay. So that the woman will know, you know, how far gone she is when she's in labor. Okay. The doctor will be telling her, Madam, don't push, you're about 6 cm dilated, you're already fully dilated. So the part of the female external genitalia that dilates during labor is actually the cervix. Okay. It is the neck of the womb. So cervical cancer is cancer affecting the cervix, which is the neck of the womb, and it occurs only in women.
Thank you very much. I would like Dr. Olufemi to buttress more on that.
Yes, thank you for that intro into it. Yes, cervical cancer, it's of course something that it's a great public health problem. Okay. Reason being that a lot of women really don't know they are at risk of it. I'm sure we're going to talk about what causes it later. But cancer of the cervix is one of the common killers of women in this part of the world. In other parts of the world, they've actually mastered the art of preventing their women from dying from it, because it's a preventable disease. Oh. Okay. And therefore, I'm very grateful that we are going to be showcasing some of the elements of that prevention through the Healthwise program that we'll be talking about today.
Thank you very much. So, Dr. Kasali, how common is this cervical cancer?
Okay, cervical cancer is a common problem globally, actually. Okay. It's a problem that occurs in all the parts of the world. It's just that in the developing countries, it's very, very common. It's commoner. In developed countries, they usually organize population-based screening programs. Okay. So because of that, it's not so common in developed countries. But in developing countries like Nigeria, you know, Southeast Asia, the cancer is very, very common. And from statistics, has shown that about 500,000 women are diagnosed annually worldwide from this disease. And out of that, about 300,000 women die annually. So every 2 minutes in the world, a woman dies of cervical cancer. So it's a major public health problem that is affecting women. So it's very, very common.
Thank you very much. So Dr. Olufemi, how important is early detection of this disease? Just
like Dr. Kasale mentioned, the science of screening has been developed to a point where we can categorically confirm it can reduce the incidence, that is how common the disease can occur, and it can reduce the mortality, how commonly it kills, in developed countries where they have done what they would call a population-based screening program. So everything is into prevention. Everything is what every resources that we put into screen a woman is worthwhile. So because that woman can be prevented from dying.
Okay, I like that point. So let's expatiate more on the link between early detection and prevention. Yes, and this is all due to the natural history of cervical cancer that we doctors now know. Unlike other cancers, cervical cancer actually has a pre-cancerous phase that lasts between 5 to 10, 15 years. Wow. So it therefore gives an opportunity for physicians or nurses, as the case may be, any healthcare worker that's trained to look at the cervix of a woman and identify this pre-cancerous condition. And such a woman can be taken away, treated, and then she continues her life. So interrupting what could have developed into a cancer many years later. And what is this precancerous condition? It's called CI 1, 2, and 3. We divide these stages into 1, 2, and 3. And we now know what causes this precancerous situation. Is a virus. A virus that is called human papilloma virus. HPV is now known to be the cause of cervical cancer. So if we know something can cause a disease, we've learned how to prevent it, then early detection, detecting it early and preventing it is the key. I'm sure viewers at home would like to know what HPV is. Can you tell us more HPV stands for human papilloma virus. It's a very simple innocuous virus that actually resides primarily on the skin, men and women. But during sexual intercourse, men pass the virus to women. And it doesn't do anything to men. We live with it for the rest of our lives. In some very rare cases, it can cause maybe penile or anal cancer for those who are homosexuals. In common population, it doesn't affect them. However, for women, a large percentage of women would absorb that virus and it stays in their body for life. They have no way of rejecting it or dealing with it. And like most viruses, you can't eradicate them. They stay there. And it gradually changes the cervix of the woman. A large percentage of women will deal with it. The way you deal with a common cold virus, it doesn't turn into a cancer immediately. But a lot of women, particularly the statistics we have in Nigeria, is that about 80% of Nigerian women will be infected in their lifetime through sexual activity. 80%. So that's a large number of women. And the first 3 years of women having sexual intercourse, there's a 50% chance that she would have been infected. So it's a really big deal. Therefore, that women should know about HPV. Now, if a woman has had sexual intercourse before, there's a possibility that she has been infected. But don't panic. It doesn't mean you have cervical cancer. It just means you need to go and check to find out where the virus had started doing some changes on the cervix.